Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi. So today I'm going to be doing a short talk on cataract and glaucoma. Patients always say my dad had cataract or I think it's glaucoma, I'm not too sure. Obviously with cataract it's not as relevant because it's something that whether you like it or not, you get it as you get older. And it can easily be fixed by taking out the cataract lens and replacing it with an intraocular lens implant. But glaucoma, on the other hand, is a nerve issue. Glaucoma cannot be fixed like that. So what happens with glaucoma is whatever damage that has been done, that is the only place you can only stop it from getting worse. So the earlier you catch it, the better it is. And that's glaucoma is something that is common in black people. Most times patients tend to not want to share their information with even family members because of privacy reasons. But I think for other conditions it's okay if you want to. As far as glaucoma is concerned, it's very important to share this information with other family members because you'll be saving them a lot of harm because obviously you don't know who may have it. Genetically, one is predisposed to it. If your parents have it, it's worse if both parents have it, and there are other family members that are very close blood-related family members that also have glaucoma. In such cases, the earlier one catches it, the better it is. So you'll be doing your family a great favor by letting them know, and also the ones that know should go and get themselves screened. The test for glaucoma entails 4 different major things, which is the intraocular pressure in the eye, the anterior chamber angle, the cup to disc ratio, and visual field, or OCT as the case may be. Then the corneal thickness, or pachymetry as it is called, is also a factor. So if all these tests are done and the nerves seem okay, then even if the pressure is high, it's considered the case of ocular hypertension and not glaucoma. But there are cases where the pressure could be low and there's a nerve damage. In that case, it's still it's called low tension glaucoma, and it's glaucoma and it has to be managed. Glaucoma can be managed using drops. There are medications for it to lower the pressure. If the pressure is low, then it won't be able to damage the nerve any further. In some cases, the drops might fail to reduce the pressure to the required level, or the safe level that won't further damage the nerve. But if the drops fail, then obviously the next other procedure is laser process or trabeculectomy. Trabeculectomy is when you open the drainage angle a little bit to create drainage channel. In some cases, do a peripheral iridotomy to just open the channel, drainage channel a little bit, so that way there's no buildup of the anterior chamber fluid. If there's no aqueous buildup, then obviously there won't be any, the pressure will not go up. So sometimes it's done, if the angle is very narrow, the surgeon might decide to do an iridotomy to open up the anterior chamber angle a little bit for safety reasons, so that even if it closes, then there's still room for the fluid to drain out. If the fluid is draining out, then the pressure will not build up. So those are the basic ways of taking care of glaucoma. So like I said, medication, if medication fails, there's laser, then if laser fails, then you have to go into main surgery itself. Unlike cataract on the other hand needs to be taken out. The implant, the lens is the cloudy lens, which we call cataract, is taken out and is replaced with an intraocular lens. And most times, so long as the eye health is okay and it's just the cataract that was causing the blurry vision, as soon as you take out the implant lens, the cataract lens, and put an implant, then vision tends to be back to normal. A lot of patients tend to confuse the fact that they've had cataract surgery done and they do not need glasses. Well, cataract surgery replaces the lens. So during the process, the surgeon, they try to calculate the lens to compensate for your distant vision error at the same time. But that's quite different from having LASIK or laser vision correction, which is a procedure that's done on the cornea to alter the shape of the cornea. And in that is when you actually will probably do the surgery and not need glasses. So there are two different procedures. Cataract surgery is done on the lens inside the eye. Laser vision correction, or like LASIK, is done on the cornea. So there are two different procedures. Altering the shape of the cornea automatically will give you more likelihood of not relying on glasses. But even with LASIK, the best result for LASIK is tailored towards your less dependence on glasses. Less dependence on glasses, and not still guaranteed that you come out and you won't need glasses. You may need, and probably very low prescription, depending on what your original prescription was and the amount of corneal tissue that you have for them to take out during the procedure. So these are two different things, and I just thought we should let everybody know. So glaucoma and cataract are two different procedures, or two different terminologies. Glaucoma refers to damage to the optic nerve, which is the nerve that takes information from the eyes to the brain. Cataract refers to a cloudy lens, which is the lens in the eye that helps the focusing system in addition to the cornea to give you sharp images being formed at the back of the eye. So in order to focus light at the back of the eye properly, there are two mechanisms that are responsible, mostly the cornea and the lens. So the lens gets cloudy, vision goes blurry. Your image that you get is a function of two things: the focusing system, which is the cornea and the intraocular lens predominantly, and the back of the eye, or the retina, the macula, which is the part responsible for vision. Then the nerve that takes information from there to the brain to interpret whatever image is being thrown at the eyes. The cornea and the lens focuses the image to the back of the eye, on the retina or the macula. So the macula has to be healthy. And that's why people say, okay, eat a lot of carrots. Carrots help on the retina. So carrots will not help, it will not change your focusing system. So you might eat all the carrots in the world and find that your vision is still not 20/20. What that means is that although the health of the back of the eye or the retina is okay, it means the focusing mechanism is not okay. Alternatively, your vision may still be blurry if the focusing system, everything is okay, but the retina is in bad health or bad shape. And that's where the carrot and other things that help the health of the retina comes into play, helping you with vision. So most parents tend to say, oh, my child's vision is poor because he's not be eating carrots. Well, obviously, carrot has a part to play in it, but that's not the main issue. The light has to focus properly at the back of the eye for our receptors to take the image to the optic nerve, which will take the image take the information to the brain. So I hope we understand this better now. So I'm not saying carrot is not important. Carrot helps the retina. The retina is not what focuses the image. So we look at it like the camera. The camera is just like the eyes. If you have a good focusing lens system and the frame where the image is supposed to focus at the back of the eye is poor, you're still going to have a blurry image. If you have a very good film at the back of the eye and the focusing system is not good, you're still going to have a blurry image either way. So in the camera, the lens or the focusing system in the camera is synonymous with the cornea and the lens in the eye. So those are the two focusing systems, just like the camera lens. Then the back of the eye, which is the retina, is also synonymous with the film on the back of the camera. So if you hold a camera in hand and you realize, like, if you shake a camera while you're trying to take a picture, you're not going to get a sharp image. If you didn't focus the lens properly while you're trying to take a picture, you're not going to get a sharp image. Same way with the eyes. If the focus system is not working properly, which is the cornea and the lens in the eye, you're not going to get a sharp image. Neither are you going to get a sharp image with your camera if the lens is bad, if the film is bad, and the focus system is okay. Same way with the eyes. You're not going to get a sharp image if the retina is damaged and the focus system is okay. So this whole thing, the whole system have to work together. You need a good focusing system on the eye, the cornea, and the lens predominantly, and the back of the eye has to be good. So that's why usually when laser vision correction is done, it's done on the cornea. Because the cornea is the main focusing system. So if you alter the shape of the cornea, then obviously you're almost good to go. So thank you, ladies and gentlemen. I think at this point it's fair enough for me to call it a day. If there are questions that you guys want me to answer, please throw them in the comment section. I'll be glad to answer them. Other than that, I think we're good enough for the day. We appreciate those that continue to share our videos. If you've not subscribed to the channel and you think you think you learned one or two things from the channel, please do so and spread the word. Thank you, ladies and gentlemen. Like the video. Comments are highly welcomed. Thank you.